I'm Michelle, and I'm going to do my presentation on domestic violence and partner violence in Russia and the United States. Just really quickly, I picked this topic because my family is from the Soviet Union, and I wanted to do this presentation on two countries that I directly connect to, and I just want to know the difference in healthcare and women's health between Russia and the US. So just some basic information about Russia. The current population is about 146 million, which is actually less than the population that was in 2015, which was a little bit over 146 million. And Russia is actually one of the few countries that has a negative growth rate. A, because there's a fall in living standards, and B, because of alcoholism, but that's an entirely different issue. And then the average life expectancy for women is 75, for men it's 63. And the percentage of men to women is actually pretty close. It's about 50-50. It's actually 54% of the population is women and 46% are men. Just a quick overview about the Russian healthcare system. The Russian Ministry of Health, which is a primary provider for healthcare, oversees the healthcare system, and it employs about 2 million people, and it covers clinics, hospitals, dentists, and pharmacies. And every Russian citizen and resident is entitled to free public healthcare. And once you begin working in Russia, your employer pays about 2 to 3% of your salary to social tax. And then from that social tax, a percentage gets taken and goes towards the healthcare fund. So once the employer pays this, then the person receives the free healthcare from most Russian public clinics. A survey was done by the CDC called Reproductive Health Survey Russia 2011, and in chapter 13 they discussed women's health. So they focused on different gynecological cancers, treatments, detections, and preventions. And they found that 62% of women reported having some type of medical service within 12 months. And within that, women who had higher education were more likely to seek care than women who had less of an education. And it was 67% of women with higher education sought primary care compared to the 55% of women who had lower education. And usually, if a woman wasn't able to get medical services, it was because she couldn't get an appointment, she didn't have time to go, or the medical office itself was just closed. And in general, older women were less likely to have breast exams, cervical exams, or basically any type of checkup because 71% of those older women said that the doctor did not recommend it. So as women age, their health isn't getting as much attention and care as it should. And the reason I bring this up is to show that women do have access to healthcare, but there is a discrimination between what kind of healthcare a woman gets based on her educational standard. So domestic violence is defined as a violent or aggressive behavior within a home that involves some sort of abuse from a partner. And over 35% of women have reported verbal abuse, 20% reported physical abuse. And 75% of the 20% that were physically abused did speak to someone about it, but most women spoke only to friends or family, and not a very few percentage of people went to the police, and even less than that followed through with legal actions. And it's said that as the education status of a woman increased, the likelihood of poor abuse decreased. So again, like women's health, education holds value. And almost 90% of the women who were physically abused didn't report it because they didn't consider it severe enough to report. February of 2017, the president of Russia, Vladimir Putin, he signed a new law easing certain penalties for domestic violence. And within these laws, something like battery, which is defined as actual physical harm done on a person, would be seen as a civil offense instead of a criminal offense, especially if it's a first time offense and if the victim has no broken bones and has no seen physical harm. And in a 2010 United Nations report, 14,000 women die each year because of their husbands or relatives. In 2018, it was said that Russian police refuse to register or investigate when women report domestic violence. And instead of investigating, the police would advise the women to just make up with their partner, the same partner who abused them. And because police refuse to investigate, women would have to go through private prosecution if they choose to, which meant that they would have to cover all the expenses and all the costs, and they would have to provide all the evidence. And the Human Rights Watch report found gaps in Russian law, which left women with no protection. And it's because that Russian law and inadequate police and inadequate judicial response, it meant that women who suffer from extreme violence had no protection. And it's because of social stigma, lack of awareness, and a lack of trust in the police that victims would rather just deal with it than go and report their abuse. Officials in Russia stated that 1 in 5 women suffer from domestic/partner violence, yet Russia is one of the only countries without laws dedicated to domestic violence. And in 2019, the European Court of Human Rights said that, quote, Russian authorities were reluctant to acknowledge the seriousness and the extent of the problem of domestic violence in Russia and its discriminatory effect on women, unquote. So clearly, domestic violence isn't getting the attention that it should because, simply put, Russia doesn't care. So this is a story about a man called Slava Voinov who used to play for the Kings, the Los Angeles hockey team. And it's just a story about how much or how little domestic violence, partner violence really means in Russia. So in 2014, Slava's wife, Marta, told an officer that he attacked her. And at the time, he was a defenseman for the Kings. And in the police report, it said that they were at a Halloween party for the Kings, and he took off his wife's glasses, stomped on them, and then punched her in her jaw. And he then spent 2 months in jail in 2015 after pleading no consent to a misdemeanor charge of a corporal injury. However, at the hospital, there was reported evidence of bruising, swelling, and red marks around her neck. And the wife also said that he gets aggressive when he drinks. So after that incident, the Kings terminated his contract, and he is still currently suspended from the NHL. After the 2 months in jail, U.S. Immigration and Customs Enforcement, they took him into custody, and he was returned back to Russia. And in Russia, he didn't really have anything against him, so he continued to play professionally for the Continental Hockey League, which he still does. And an NBC analyst, Mike Milbury, said this guy was a special player, and an unfortunate incident left the Los Angeles Kings without a great defenseman. So Milbury himself also downplayed what actually happened, as if domestic violence is nothing. And just as a quick side note, Voinov is representing Russia at the Olympics, which just goes to show how little they really care about accusations of domestic violence or partner violence. And both him and his wife returned to Russia. They're still married, and now they even have a child together. Now that we know a little bit about how Russia views domestic violence, I'm going to now compare it to how the United States views domestic violence. Now for some basic facts about the United States. The current population is about 330 million. The life expectancy for women is around 81, and for men it's around 76. And it's actually a very, very, very close split of almost 50-50 men to women. It's actually even closer than it is to Russia, with it being 51% women, 49% men. Now, in terms of healthcare in the United States, there is no universal healthcare, and we're considered to be quote unquote a hybrid system, which means that there's a mix of private and public systems. And it's recently enacted mandatory health coverage for almost everyone, which means that basically everyone needs some sort of health insurance. And in 2014, almost 90% of the population in the US has some sort of health insurance or health care, and 66% were covered by private insurances. And it's also noted that even if it's a public system, so if it's publicly financed, the healthcare itself is delivered privately. So majority of the healthcare is private, and also 33 million people did not have insurance. In 2013, the Organization for Economic Cooperation and Development compared 34 countries and their government policies, with the US being one of the countries that they studied, and they found that the US spend over $9,000 per person on healthcare, which was over double the average, which was about 3,500. And the high cost is the most common reason why Americans don't have insurance. It's also because the premiums and deductibles keep rising, so it's hard to keep up with it. Women often face higher premium than men, even if it's through the same coverage, through the same insurance, through the same everything. Women just have to pay more. But in 2014, with the Affordable Care Act, this basically banned women having to pay more for being women. So as mentioned in the previous slide, in 2014, the Affordable Care Act was passed and it was made to protect women from discrimination. And in 2018, a study was done by the Commonwealth Fund to compare US women to women in 11 other countries. And they found that US women had the greatest burden of chronic illness, the highest rate of skipping healthcare because of cost. And over 25% of women spent $2,000 out of pocket for medical care because their insurance simply wouldn't cover it. So US women have difficulty with affordability of healthcare, and they are often the least satisfied out of all the women because they don't get what they need. According to the National Coalition Against Domestic Violence, 20 people per minute are physically abused, which means that about 10 million people, 10 million plus people a year are abused. 1 in 4 women and 1 in 9 men experience intimate partner violence and or sexual violence. 1 in 4 women and one in 7 men are victims to severe physical violence, and only 34% of people who are injured by their partners receive any sort of care afterwards. So, to deal with domestic violence, in 1994, the US Congress passed the Violence Against Women Act, and it recognized violence as a national crime. And majority of domestic violence cases are handled by state or local authorities. And this just goes to show that compared to Russia, the US has some type of law dealing with domestic violence. So the US recognizes domestic violence as being an issue, as being ongoing, and as being something that needs to be taken seriously. Women often don't speak up about the abuse that they endure, and that's usually because there's a stigma around it, and there's a cultural and societal fear of just being judged, and admitting what happened can often be seen as humiliating for the woman the victim who suffered from all the abuse. And most women don't come forward about their abuse because of the stigma surrounding it. And women are often ashamed of even admitting to the abuse because some of them choose to stay in those types of relationships. We often only really hear the most horrible and or extreme cases of domestic abuse because they're the cases that usually tend to get publicly acknowledged. And in the UK earlier this year in January, the Home Office and Ministry of Justice released a draft bill transforming the response to domestic abuse. And the reason for this bill is because the UK wants to improve public health awareness and the support of domestic violence. They also want to prioritize the safety of the victims and to strengthen the response to domestic abuse. And in the draft bill, part of it was to update the definition of domestic abuse. So now the definition is to include that it's a complex, it's ongoing, and that it can involve psychological, physical, sexual, economic, and emotional dimensions, as well as being part of controlling acts and behaviors. So a central measure of the draft bill is the introduction of an actual definition for domestic abuse. And the reason I'm bringing this up is because President Trump in 2018 also changed the definition of domestic abuse, except he changed it so that the definition included physical harm, but not psychological harm. So although we have laws and protections like the Violence Against Women Act, we're still not at that level to really acknowledge the extent of how far domestic violence goes, and there's just a lot more that has to be done. So, domestic violence. Why does it happen? The typical and the classic answers are that it's usually for power, to either gain it or maintain it, it's control, it's to restrict, and it's to show that the person you're hurting, the person you're abusing, their needs come after yours. So you are number one, everyone else is below you. And for the question of why are women the most common like people getting abused, one is because women usually stay silent after, but the biggest reason is that it's really unknown. Stereotypically, men usually are the powerful ones and usually quote unquote put women in their place, but the actual research and science behind it, it's really unclear why women have to suffer through all this. Aside from the obvious physical harms that we see or impacts that we see because of domestic abuse or partner abuse, like bruises or cuts or scrapes or anything like that, there's a lot more that comes with it. And between 20 to 60% of victims will end up losing their jobs because of reasons stemming from the abuse. So they might not be able to, they might miss work because they don't feel like coming in, or they might not be able to keep up with the workload, or they might not just be able to do what they're supposed to do, which becomes an issue for their job, and they might end up losing their job because they're no longer performing the way they're supposed to be performing. Women who are abused are also more vulnerable to getting HIV and other STDs, other STIs, because of the forced intercourse and prolonged exposure to stress. There's also a relationship between partner violence and depression and suicidal behaviors. So those who are victims tend to have more problems with alcohol, more problems with smoking, more problems with tobacco, and tend to have more likelihood of becoming depressed. And victims are also at higher risk for developing addictions, like I said before, alcohol, smoking, other types of drugs, tobacco, or anything else that they might use to lessen or ease the pain of the memories or the physical abuse and remnants of being abused. So, when comparing Russia to the US, there are very, very, very clear differences. The Russia has less people, less domestic violence, but also has less laws around the protection of women, women's health, and simply acknowledging what domestic violence is. And also the police in Russia, they don't take accusations seriously. So for them, it's more of a bury it under the rug type of thing. In the US, however, there are more laws around it, but there's more violence. And in the US, there are a lot of victims that we know of, and there are even more that we don't know of because there's this fear of stigma. There's this fear of being judged and being basically thinking that you're humiliating yourself. So, in terms of cultural differences, I'm speaking from not necessarily experience, but I guess stereotyping Russians versus Americans. So, Russian women tend to be a lot tougher than American women. And I even asked my parents about how domestic abuse was when they lived there. And my dad literally said, "What about it? What about it? The husband would come home drunk, they would fight, they would both go to sleep, and then they move on." So in Russia, it's more of a norm, I guess. And that's not to say that Russians are abusive altogether, it's just to say that it's just the type of thing of what's happening. And because of that, that's really why there aren't so many sources or studies or journals about Russian domestic violence, because everything is just very, it is what it is, it's a hush hush type of situation. So American women, however, especially in more recent years, they have become a lot more vocal about domestic and partner violence, and they begin to speak up about it a lot more, which is amazing because the more acknowledgement this issue gets, the more that we'll move towards a place to deal with it in a right way. And now women are demanding a lot more protection. They're demanding that things actually be done. And unlike Russia, they think that their accusations should be taken seriously, which they 100% should be. So American women tend to speak up more about it because domestic abuse isn't excusable. And in Russia, it's not given the severity of what it actually is. So now, for my discussion questions, I'm really curious to know what everyone else thinks about what's happening in Russia and the US. So it's very weird that the US has more domestic violence laws, but there are more incidences of domestic violence. So why is that? Is it something cultural? Is it something societal? Or is it something else? But do having more of these laws help or worsen the situation? Because clearly there's some sort of something there. If Russia doesn't have any laws, but they have way less domestic violence than we do, but we have more laws and we have more violence, then how does that make sense? And then the second question would be, over the past few years, more and more women have come out about abusive relationships, being with their partner or anyone else. But why now? It's like this has been an issue for God knows how long, but why is the issue more relevant and more, I guess, people trying to take more of a charge at it and more change toward it? Why now?